Good morning, dear students. In this session, we are going to see about stress and adaptation. So, in the last session, we have dealt with the stress, the concept about various stressors, and how the homeostasis. So, we have seen about the physiological homeostasis. So, in this lesson, we will be seeing about psychological homeostasis and the stress management approaches. And this is a very interesting and easy topic. So, first of all, we'll see about the psychological homeostasis. So, it is important for every human being to maintain psychological homeostasis to deal a healthy life. So, in order to deal with a stress, a person is maintaining a psychological equilibrium. So, what are the ways to maintain this psychological homeostasis? That is the mind body reaction, level of anxiety, coping mechanisms, and defense mechanisms. So, this mind body interaction that we have seen in the previous class, that is the physiological adaptation, mainly the alarm reaction, how the body is responding to the stressful situation by the hormonal production and all. So we have seen that in the alarm reaction. Next is the level of anxiety. As a response to a stressful situation, there is an anxiety arise in our human inside us. That the anxiety is body's natural response to stress. It's a feeling of fear about what's to come. So there are three levels of anxiety, mainly that is mild, moderate, and severe anxiety, and that is a very severe anxiety is the panic situation. Next is the coping mechanism. Psychologists Richard Lazarus and Susan Folkman. Coping, it is the sum of cognitive and behavioral efforts that aim to handle stressful situations or problems that emerge because of our stressors. So we have seen different stressors in the last session. So this is like what all efforts that is in the cognitive and behavioral level that a person is taking to handle a stressful situation. So mainly we can see reactive coping and proactive coping. So reactive coping is because of a stressor, because of that stressful situation, what is the response of a person? Coping as a response. Then proactive coping is it is aimed at preventing a possible encounter with a future stressor. Next is defense mechanism. So you know about this defense mechanism, so I'm not going to explain. The major defense mechanisms are denial, repression, projection, displacement, regression, rationalization, sublimation, and reaction formation. So in order to maintain the equilibrium in the psychological level, person is adopting all these defense mechanisms. So we have seen psychological homeostasis or psychological adaptation, the major areas like mind body reaction, level of anxiety, coping mechanisms, and defense mechanisms. Hope you understood this. Now we are moving on to the signs and symptoms of stress. So we are seeing the signs and symptoms of stress mainly in physiological and physical level, cognitive level, emotional level, and behavioral level. So we'll see one by one how in physiological or physical level. Increased heart rate, increased blood pressure, dilated pupil, muscle tension, nausea and dizziness, aches and pain. Cognitive memory problem, yeah, if a person is going under any stressful stimuli, there is some impairment of memory, you can see inability to concentrate, anxious thoughts, and constant worrying. Next is emotional symptoms, moodiness, irritability and short tempered, agitation or inability to relax, sense of loneliness. Next is about the behavioral symptoms, eating more or eating less, sleeping too much or sleeping too little, isolating yourself from others, neglecting responsibilities. The person is not carrying out the responsibilities. using alcohol, cigarettes. So we'll be seeing the stress management approaches in mainly in three levels, that is action oriented approaches, emotion oriented approaches, and acceptance oriented approaches. So this action oriented approaches, it is used to take some action a person is taking to change a stressful situation. Next is emotion oriented approaches. The person is changing his or her perception. And acceptance oriented approaches, that is, it is used for dealing with stressful situations one can't control. Action oriented approaches, the main approaches are modifying one's lifestyle, reducing stressors, being assertive, addressing perfection, and anger management. So we'll see one by one. Modifying lifestyle, under this you can see dietary modifications, regular activity and exercise, rest and sleep, leisure activities, time management, and avoiding maladaptive behavior. So we'll see in detail modifying lifestyle, that is mainly diet. Balanced diet is very important for maintaining physical homeostasis and resisting stress, like overweight or underweight or malnutrition. It can act as a stressor. So in order to avoid these stressors, person is modifying the diet and following a balanced diet. Next is regular activity and exercise. Regular physical activity and exercise can be very helpful to improve muscle tone and controlling weight. Next is rest and sleep. So energy level is restoring by adequate sleep and rest. Next, you can see the leisure activities. Activities like reading, painting, gardening, or engaging in any hobbies are act as rest as well as restorative. Next is time management. Poor time management is one of the greatest source of stress. So making timely plan for activity, organizing routine. So these all things are very essential for reducing stress. Avoiding maladaptive behavior like drinking, smoking, consuming excessive caffeine, using substance. These are some factors increases stress. Next is reducing stressors. So here our role is very important because as a nurse we have to give health education to the person, or we are giving some psychological support to the person in order to identify the stressors and the source of stress and what all coping strategies he can take in order to effectively reduce or manage the stress. Next is being assertive. So here being assertive, it means the person's confidence. That is, a clear and effective communication is the key to being assertive. Once you identify what you need to communicate, you can stand up for yourself and be proactive in altering the stressful situation. Next is addressing perfectionism. That is, unrealistic goals make individual more stressful. So here we are helping the person to make some realistic goals. Next is anger management. Some relaxation techniques we can teach the person in order to manage his anger. So moving further, that is emotion oriented approaches. So first initially we have seen the action oriented approach. Here emotion oriented approaches. First is affirmations and imagery. The power of positive imagery is now scientifically proven to increase positive emotion. So, replace the negative thoughts with positive statements and challenge and change the way you see and experience the world. So, here we are encouraging the person to replace the negative thoughts with positive thoughts. Next is cognitive restructuring, and it is introduced by Dr. Albert Ellis. It is a technique for understanding negative emotion and challenging the sometimes incorrect beliefs that cause them. So here we are advising the person to understand the negative emotions and how that negative emotions cause stress in the person, and we are motivating the person in order to lead, or in order to gain some positive, or in order to think in a positive way. And this cognitive restructuring is a key component of cognitive behavioral therapy. Next is emotion oriented approach. Next technique is ABC technique. This is also originally created by psychologist Dr. Albert Ellis. A stands for adversity or the stressful event, B is for beliefs, and the C is the consequences. That is, the result of your beliefs lead to the actions and outcome of that event. Next is, or the last approach is the acceptance oriented approach. So here the person is accepting, yes, I am undergoing certain stressful, or I am undergoing in stress. So what all things I can do to reduce the stress or manage this? So meditation, physical relaxation, techniques like deep breathing, guided visualizations, yoga, guided body scans. These activities help to relax the body. Next is build resilience. Resilience is our ability to recover quickly from difficulties or stress. Like instead of going down, or instead of yeah, you know, that instead of accepting that we have failed, instead of that we are telling, that is, I am coming up, or I can conquer this situation. That is the ability to recover quickly from difficulties or stress. Next is talk it out. Talk to someone close to you about the worries or the things getting one down. Here you can see, or you can utilize the support system like family, community, peer group can be source of support system where an individual can express his or her thoughts. So this is about the different approaches for stress management. So in this class, we have seen about the psychological adaptation, mind-body reaction, level of anxiety, coping mechanism and defense mechanisms, and main signs and symptoms of stress in physical and physiological area, by behavioral area, and emotional area, and how we can manage the stress. Different approaches: action oriented approaches, emotion oriented approaches, and acceptance oriented approaches. So hope you understood this class. Thank you for listening.